have another kind of general question that just came through the chat. What are we learning about prevention and causes of lung cancer? Does the US have a higher incidence, I guess, to other regions in the world? One of the
Um,
things. Oh, sorry, go ahead.
No, I was just going to mention, I mean, we are obviously, there's a lot of research being conducted in terms of like the causes of lung cancer. I mean, just a few months ago, there were a series of papers from the UK about air pollution and how air pollutants can lead to lung cancer, even in patients who are never smokers. So I think there's obviously ongoing research. We're learning a lot in terms of what kind of particulate matter may be responsible for lung cancer. In terms of prevention, I mean, there are increasingly, I mean, at least in the literature, I'm seeing increasingly number of different models we're using to identify. There's AI-based, CT lung cancer screening models to see whether we can, really predict which lung nodules may develop in the cancer. So there's a lot of ongoing research, but I think just in general, etiology prevention, sort of this epidemiological research is very difficult just because it's not, as simple in the terms of understanding that you have a cancer, you treat it, it shrinks, then it's working. So I think that's why some of the roadblocks to actually our understanding, but it still has gone a long way since we started.
I think another interesting kind of side aspect to that question is, can we actually screen more patients for lung cancer? Are our screening guidelines really encompassing the maximum number of patients that should be screened for lung cancer? And for example, Dr. Elaine Shum at NYU is leading a very interesting study at looking at lung cancer screening for young Asian female never smokers, because we do know that this is a population that might be at greater risk for some of these driver mutation lung cancers. Now, that's not everybody, obviously, and we, at the end of the day, can't screen everybody for lung cancer, but I think asking what populations warrant additional screening so we can detect these cancers earlier and cure more of them is also an important aspect to that question.
Progress is being made slowly but surely, and I think what we can do is what patients can do is for all the people that are former smokers or active smokers, just really advocate that they ask their PCPs to order a lung cancer screening study. It's still so underutilized in the United States, even though there's great data to support lung cancer screening, and it's something that is low-hanging fruit that I think everybody that is a lung cancer survivor can really help us with by just spreading the word to your community, your circle, your network, your family, your friends. And hopefully we can see that improve over time.